One of the patients is 13-year-old Frederic. At 9 months old, it was diagnosed that he might have suffered a prenatal stroke sometime between the 5th and the 6th month of pregnancy. After 12 years of therapy, he was considered untreatable, and the medical experts confirmed that he would spend the rest of his life paralyzed on one side. When Frederic came to Ambulanticum, he wasn't able to use his right arm at all. He had hardly any proprioception of his affected arm and wasn't using his hand in his daily routine. By using robotics and therapeutic devices, we wanted to increase his awareness and to enable him to use his affected arm. He had only very little function, and we were able to increase it slowly. The biofeedback helped him a lot in this process. We are very proud to see that he is now using both of his hands in his daily routine and that he is becoming more and more independent.
Frederic has already had 1,700 therapy sessions, and they've led to slight improvements of his abilities. However, the intensive therapy at Ambulanticum was a real breakthrough for him in his progress toward using his right arm and hand. Specifically, the therapy with ArmeoSpring played a crucial role. Frederic trained with it intensively and had a lot of fun in doing so. We notice the progress especially in his daily routine, where he is independently using his newly acquired abilities. For example, he'll now pour himself a glass of water with his right hand, or he'll try to tie his shoes. It's the small things. His self-esteem has improved immensely, and he is much more confident in his abilities. We are very grateful that he's made these improvements through training with ArmeoSpring at Ambulanticum.
Therapy for this situation doesn't come cheap, as the German health insurance would only cover 1 to 2 hours of conventional outpatient physio and ergotherapy per week. Without any visible progress, the patient is considered untreatable and would need lifelong care. With this intensive therapy concept, Ambulanticum contradicts this prognosis. Here, especially for chronic or severely affected patients, the individual performance and potential of each patient is the only limiting factor.